mode.
Good morning or good afternoon or even potentially good evening, depending on where you're joining us from today. We welcome you to our LSVT Global webinar entitled Improving Communication and Movement Through Evidence-Based Speech, Physical, and Occupational Therapies in People with Parkinson's Disease. We're delighted to have you here with us today and hope that you'll find this information very useful. As always, we like to acknowledge much of the research support that we've had over the past 25 years that have allowed us to develop these protocols and be able to actually provide evidence-based practice. The webinar will be presented by myself. My name is Cynthia Fox and my colleague, Laura Gousset. I'll tell you just a little bit about us. I'm a speech language pathologist. I've been part of the LSVT research team for over 20 years now, have worked closely with Dr. Lorraine Ramig. I'm currently also faculty for both LSVT Loud and LSVT Big training workshops, and one of the co-founders of the company LSVT Global that trains and certifies clinicians around the world and supports events such as this, educational events, these webinars. I'm with my colleague, Laura Gousset. She is a physical therapist. She has 15 years or more experience with a specialty really in neurological conditions and Parkinson's disease. Laura has treated hundreds of patients utilizing LSVT Big. She's one of our LSVT Big training faculty. She's the Chief Clinical Officer for LSVT Big within our company, LSVT Global. I greet you from Tucson, Arizona, and Laura is joining us today from Lexington, Kentucky. The plan for the presentation today is I'll explain a few quick logistics, then we'll get to the heart of the matter, which is to present the webinar to you. There'll be a time period at the end for question answers, and we'll tell you how to go about answering questions at the end of the webinar. And then when we conclude and you close out of the webinar, it will automatically launch a short survey. It'll take you less than 5 minutes to complete, and we really hope you'll be able to do that as it guides our knowledge and planning for future webinars. In terms of logistics, as I mentioned at the end, you'll be able to answer questions either by typing them in or raising your hand, and Laura will explain that in more detail. There's also a handout attached to this webinar that you could download to be able to have, or you may have received the webinar email that actually had that handout attached. If you have any difficulties accessing that and you'd like a copy of it after this webinar is over, just email us and we'd be happy to send that again. The objectives for this webinar today are to discuss development and data on the efficacious speech protocol, LSVT Loud, and highlight some of those treatment concepts. And I'll just touch quickly on the ability to offer LSVT Loud through some new technologies. That will serve as a basis for the next discussion on the development and key aspects of LSVT Big. And then we'll end by providing you with a list of some additional resources to learn more about these treatment protocols. In a 1-hour webinar summarizing 25 years of research and clinical data, we can only give you a very high-level view, but we have a lot of ways that you could decide if you'd like to learn more, how to learn in a lot more depth. This brings us to our very first polling question, and so this allows you to participate in our webinar as well. So our first question for you that will appear now on your screen is this your first LSVT Global webinar? So you should have the ability now to vote yes or no, and I'm just going to give about 15 seconds here to allow everybody to participate, and then we'll share the results. Okay, so it looks like we have a lot of new individuals joining us today. That's very exciting. 91% of you said, yes, this is my first webinar with us, and then 9% no. So that's great. Welcome everybody who is new, and welcome back those of you who've not or who have attended in the past. One more question to learn just a little bit more about you, and that should appear now, is we just want to know a little bit about who you are. Are you a professional therapist, a speech, physical, occupational therapist? Perhaps you're a student in one of these types of programs. Maybe you're a person with Parkinson's disease, or a caregiver or loved one with some Parkinson's disease, or another category that we didn't come up with. So we will allow, again, about 10 more seconds for voting, and then we can share those responses. Okay, 100% have voted. I'll close the poll. I'll share the results. And it looks like we have a majority of our audience who are people with Parkinson's disease. That's fabulous, because this is very much geared towards providing you with more information. So 58% there, 25% care partners, and 17% professional speech therapists. Okay, now that we know who we're talking to, let's get back to our slides, and we'll dig into our content. So today, rehabilitation really has become a part of routine management in people with Parkinson's disease. And whereas traditionally Parkinson's was predominantly treated neuropharmacologically, neurosurgically, and speech, physical, and occupational therapies were often later stage referrals, and they were for secondary impairments such as a hip fracture from a fall or pneumonia from a swallowing problem. But that's changed, and today we're seeing that people are being referred for speech, physical, occupational therapy, as well as general exercise early, even upon diagnosis. And what the neuroscience literature has taught us, that early, intensive, specific rehabilitation can improve function in people with Parkinson's disease, and may have the potential with continuous exercise and tune-ups to actually slow symptom progression. So that's very exciting, and we found that for many people with Parkinson's disease, it's also very empowering, because it's something that you learn how to do for yourself that can really give you control over managing symptoms of Parkinson's disease. So our specific work at LSVT Global that we will be focusing on today is based on, again, 25 years of funding from the National Institutes of Health in terms of research, as well as our vast clinical experience. And what that really has allowed us to do is to bridge both worlds. So we have our basic scientific research, but we've also taken that, translated it to the real world, and understand, can what we developed in the laboratory actually work in clinical practice? And the answer is absolutely yes. And having both of these arms really is a unique feature of what we have done in LSVT. So LSVT stands for Lee Silverman Voice Treatment. Mrs. Silverman actually was a woman living with Parkinson's disease when Dr. Lorraine Ramig started this work many years ago, and so the treatment was named in her honor. Today, we typically only use the acronym LSVT because we've gone beyond just the voice treatment. So LSVT Loud designates the speech therapy, and that's delivered by LSVT Loud certified speech language pathologist. LSVT Big is an extension of that. That's a physical or occupational therapy program, and it's delivered by LSVT Big certified physical or occupational therapist. So as an introduction to these treatments, we'd like to show you two videos. I will tell you that sometimes the fidelity of the videos as they are translated through the webinar and internet connections can be a little choppy. So if it doesn't come through clearly, please know that after the webinar, if you log on to our website, lsvtglobal.com, There is a tab on the main menu called Video and Media, or News and Video, and you can watch these videos again, as well as a number of additional videos to see them without perhaps the jumpy video quality. For speech, however, you'll be able to hear the changes quite well, even if the video doesn't quite match. So we'll begin with the video of a woman who received LSVT Loud. She was 59 years old at the time she was treated, 2.5 years post-diagnosis. She is on her medication pre-treatment, on her medication post-treatment, and you'll see here immediately, and they did not change during the 1 month of intensive physical exercise of the speech mechanism. So we'll now take a look at Shirley.
Have you noticed any changes in your speech or your voice that you would associate with Parkinson's?
Yes, I don't speak loud enough a lot of times.
Anything else?
Hoarse.
Anything else?
I stutter, which I never did before.
Do this for me if you would. Take a deep breath and say ah for as long as you can. Good for you. Okay. Would you say Parkinson's disease has caused you to talk less?
Yes.
Because?
Because I stutter and then I can't be heard. If there's noise in the house, like when the kids come over, nobody pays attention to it because they can't hear me. Until I get mad and then yell.
Take a deep breath and say ah for as long as you can. Have you noticed changes in your speech or your voice as a result of the speech therapy?
Oh, yes.
What have you noticed?
I talk louder. I think louder. I'm going to sing with the Sons of the Pioneers one of these days with my voice.
Good for you. That's excellent. What practicing do you do at home?
My ahs, my highs, and my lows. And I read out the mail out loud.
Excellent. Do you feel like practicing helps?
Oh, yes.
Okay. Do you feel as though people can understand you all of the time now?
Majority of the time, unless it's my husband, and he'll say, "Well, I can't hear you."
Good for you.
But I think he does that just to be cute.
I think he does too. Has anyone commented that it's easier to understand you now?
Oh, yes. I set some of our friends back when we went to their house, and I talked loud. Lou says, "What the hell happened to you?" My daughter said, "Oh, Ma, that's you?"
Isn't that good? Don't you feel wonderful?
Oh, yeah, because now she can't say, "I didn't understand what you said."
Right? No excuses, right?
Yeah,
That's
no
right.
excuses.
All right. So what do you do when you want to be as easy to understand as possible?
Think loud.
Okay, so that's a really nice example of the types of changes that we can achieve in communication before and after LSVT Loud. Yes, she got louder, but you may have heard other things change, that her intonation was better, the clarity of her voice was better, the articulation was even more clear. And certainly you saw that personality come alive. And of course, LSVT Loud didn't give her that fun personality. She's always had it, but it was being masked to some degree under the soft voice and and masked facial expression. And so these are very classic changes that we can see with just 1 month of intensive speech therapy. So now let's take a look at a video of a gentleman who went through LSVT Big. So this gentleman was 71 years old at the time he was diagnosed in 1994. He was referred to physical therapy for slowness and difficulty walking, a history of falls and freezing. He was optimized on his medication and Hoehn-Yahr stage 3, which would really be about mid-stage of Parkinson's disease. So this video will play. There is no audio in the video. And again, it may appear a little jumpy on your screen, but you could watch it on our website after the webinar is over. But what you see on the left-hand side is him walking out of the clinic the very first day after treatment. And on the right-hand side, the last day after treatment. And so you can tell that pre-treatment he's using a cane. He has slower steps, smaller steps. You may notice that he got a little bit of hesitation or freezing as he entered and passed through that doorway. And after treatment, he's walking much faster, using bigger steps, a bit better arm swing. And what's important is he's keeping it up. So it's not just 10 steps out the door and then going back to the smaller movements. And even though the video may be a bit choppy, he has walked past his car and around the parking lot in the post video before he actually really makes it to his car in the pre-treatment video. So what we found was that after treatment, he reduced his numbers of falls. He actually got rid of using the cane. His confidence improved, his speed improved, his endurance improved. But more importantly, he met his goals, and that was to walk better so he could do things he enjoyed in life, go to the movies, play with his grandchildren, and go out to dinner with family and friends. So both of these examples are really nice examples of the power of intensive speech, physical, or occupational types of therapies. So let's give you a little background on where all of this actually began. As I mentioned, Lee Silverman, or LSVT stands for Lee Silverman Voice Treatment, and this is a picture of Mrs. Lee Silverman. And when Dr. Ramig met the Silverman family back in the late 1980s, it was their expressed wish, if only we could hear and understand her. So that inability to communicate was devastating to the family as well as to Mrs. Silverman, especially at her more advanced stage of disease. And so this was the impetus of the work and the next 25 years of science led by Dr. Ramig. We recognize, and it's important to know, that over 89% of the nearly 6 million people with Parkinson's disease worldwide suffer from voice and speech problems. So it's very common that voice and speech will change with Parkinson's disease. The most common changes that occur is that the voice gets softer, so reduced loudness. Sometimes you might get a hoarse or breathy voice quality. A lot of the inflection and intonation that you may hear in my voice goes away, so the voice gets a little more monotone, a little more soft, a little more breathy. And then imprecise articulation. And so, does it matter that these changes happen? And it absolutely does. And some wonderful work from Nick Miller out of the University of Newcastle in the UK has shown that these changes, even if they're subtle in early Parkinson's disease, contribute to frustration, embarrassment, and social isolation for many people with Parkinson's disease. And this quote from one of Dr. Ramig's patients, I think, really sums it up. And she said, "If I have no voice, I have no life." We also recognize that classic medical surgeries alone do not consistently or significantly improve communication. So there's no evidence that taking your medication that may make you feel better overall, may help you move better, oftentimes doesn't improve speech. And dysarthria is often the term that's used to describe the speech problem in Parkinson's. And surgical interventions as well have not been shown to effectively or consistently improve speech. And unfortunately, in some cases, some of the surgical approaches have actually made speech worse. And so there's a lot of focus and research to understand that so we don't have to have that negative consequence. So the summary at the time Dr. Ramig began this work, it was a bit of a grim picture. It was even published in the literature that there are no effective voice and speech treatments for people with Parkinson's disease. The good news today is that is absolutely not the case. And so we have a lot of evidence now supporting that speech treatment can work and last in people with Parkinson's disease. And LSVT Loud has the greatest amount of research and really has led the field. So now I'd like to turn the tides, and if you'd like to know more research, we have 15 pages of a bibliography of articles, and so if you'd like to have that, we would send that to you. But again, today's point is kind of a high-level overview. But I want to talk about the general treatment concepts, and then I will share just a little bit of research data with you. So one of the key concepts in LSVT Loud is that the target is loudness, or amplitude you could think of as another way. So what we see in this gentleman on the left-hand side of the screen is that with Parkinson's, sometimes the drive from the brain is reduced. So you may not take as big of a breath, you may not close your vocal folds all the way, may not open your mouth all the way, and so what comes out is softer speech. We use the cue of loudness to change that. So with one simple cue of loud, as you saw with Shirley, she was taking a bigger breath, closing her vocal folds, opening her mouth more, and out came louder, more intelligible speech. But as a speech clinician, I didn't have to teach her to sit up straight, take a deep breath, think loud, over-articulate, open your mouth. Way too many confused, and it's challenging. So with one simple cue of loudness, all of these effects can happen. It's always important to note that when we talk about loudness, we're talking about healthy, normal loudness. So remember, people with Parkinson's disease get too soft. So you have to feel louder than you think you need to be just to be at a level that listeners and people in your environment perceive as normal loudness. The treatment would never teach somebody to talk too loud because that in and of itself is not functional. The mode of delivery is intensive and high effort. So when you sign up for therapy, you need to be prepared. Schedule out a month when you have time for the 4 days a week for 4 consecutive weeks. They're 1-hour individual treatment sessions. You have daily homework practice all 30 days of the week, daily carryover exercises all 30 days of the week, and we're really establishing a lifelong habit of practice. You can't end the 1 month and then stop and maintain effects. So when you're in treatment, your clinician will help you develop a daily routine of 10, 15 minutes in the morning of vocal exercises that set you up for success in the day. Now, while at first blush that may seem like a lot, it's 1 month, 16 hours out of your lifetime to dedicate to improve communication. You deserve that, and it will absolutely give back to you in terms of value more than you put into it. This intensive mode is very consistent with principles that drive activity-dependent neuroplasticity, and those are changes in the brain. And you have to have sufficient intensity to really make treatment effects that last over time. This is the only mode of delivery of LSVT Loud, and as you'll hear from Laura, LSVT Big. If any therapist offers you treatment that is less intensive than this, you are not receiving LSVT Loud, and I would encourage you to not seek treatment with that therapist. This is the dosage that will get you the changes that you just saw in those 2 videos. An overview of the exercise. A session is typically broken into 2 halves. The first half of the session are spent on these kind of standard exercises. You'll do these big ahs, like you heard Shirley. Then to help improve intonation, we'll do ah, up high, ah, down low. We'll have you come up with some phrases you say every day, like I love you, or where are my glasses? Practice them over and over again so they become a reminder to always use your loud voice. With that voice we've scaled up in the first half, in the second half of the session, we put it in a speech hierarchy that builds your endurance of maintaining loudness for longer periods of time, as well as increasing the complexity. So we'll start simple, reading words and phrases. Then we'll go longer to sentences, maybe paragraph reading. And by week 4, we're in conversation. We're taking outside of the treatment room. We're dual tasking. So we're making it as real world as possible so that you're comfortable with the louder voice. You know what you need to do, and you can walk out the door and put it into your daily life. And we also have to retrain your perception of what normal loudness feels and sounds like. Every single person with Parkinson's disease, when we first get you louder, you will say, I can't talk like this. I feel like I'm shouting. This is not right. And it's because you've gotten too soft. So we say that actually, if you don't feel like you're talking too loud, you're probably not talking loud enough. And that's the hardest part of really retraining speech in people with Parkinson's disease. But it's why having your certified LSVT clinician is so important to have successful outcomes. So in these last few minutes that you'll hear from me, let me just share a little bit of our data. This graph was from our first randomized controlled trial that we conducted on LSVT Loud. The x-axis along the bottom is time, so going from pre-treatment out to immediately post-treatment. Then we looked at 6, 12, 24 months later. And on the y-axis, this is decibels of sound pressure level, and that's a measure that levels loudness. So the higher up, the louder the output, and the task patients did was reading. We had 45 subjects who were randomly assigned to either receive LSVT Loud or a comparable treatment in terms of intensity, homework, clinician care, but it focused on only respiratory support versus respiratory and vocal loudness that we did in LSVT. LSVT is red, respiratory group is blue, and what you'll see is that immediately post-treatment, both groups got better, but LSVT more so. And then when you follow them all the way out to 2 years after that initial treatment, only the group that received LSVT Loud maintained improvements above baseline and better than an alternative treatment group. We have since this time completed 2 more randomized controlled trials. The second one is published and the third one is in process of being published. In addition to just establishing that the treatment works, we've also looked at a lot of what we call cross-system effects. That is changes that were more than just what we did with vocal loudness. You may have seen and heard some of those in Shirley, but we've looked at changes in swallowing, in facial expression, respiration, as well as neural functioning. And again, if you're interested to learn any more of this research, we'd be happy to share that with you. And finally, we recognize that to increase accessibility so that more patients who could benefit from this treatment have access to this treatment, we're turning to technology to assist in that. One of the very cool things we do on the left-hand side of the screen is telemedicine. And there's actually 6 to 8 articles published now that show if LSVT Loud is done via telemedicine, it can be as effective as face-to-face. So telemedicine would be not unlike what's happening here. I'm in my office, you would be in your home or office, and we'd have a video conferencing, and I'd be able to deliver LSVT Loud treatment to you. On the right-hand side of the screen is a step further from that, and this is a software program we've developed with funding from NIH as well as the Michael J. Fox Foundation. This program, if you're a therapist, helps you collect and manage your treatment data, but if you're a person with Parkinson's disease, it can be a treatment tool. And in our research study that we did, 9 of the 16 sessions were done in the clinic. 7 of the sessions were done at home with the patient using this software program that guides them through the treatment session. We looked at outcomes pre, post, and 6 months, and outcome data were as good at 6 months if the patient used the companion software as if they had done all sessions face to face. So we see both of these tools as ways to increase accessibility if there's geographical barriers, you live far away, or even people who are working full time, they can do some of the sessions at home on their own using the companion software. So all very exciting. With that, I will now turn the microphone over to Laura, who's going to give you all of the same type of information related to LSVT Big.
All right, thank you, Cynthia. You can go ahead to the next slide. So Cynthia had mentioned that LSVT Loud and LSVT Big protocols have been studied over the last 25 years, but LSVT Loud was really the precursor to LSVT Big. And so around the year 2000, after all of this fabulous research had been done, really establishing the efficacy of LSVT Loud, the question arose of could we apply these principles and this research to the limb motor system, in other words, your movements, how your arms and your legs and your body moves, instead of only applying it to the speech motor system. And so from there, we translated the LSVT Loud protocol directly to a physical therapy and occupational therapy protocol, which we now call LSVT Big, meaning big movements with your body, with your arms and legs and posture. So go ahead to the next slide. So what you'll be hearing from me regarding LSVT Big is very similar to what Cynthia just taught you about LSVT Loud in terms of the key principles that are very unique to the LSVT protocols. So in LSVT Big, our focus is on the target of larger movements with your limbs. So that could be larger movements with your arms, larger steps when you walk, larger arm swing, bigger posture, even bigger movements with your fingers so that you can write more effectively or button your buttons more effectively. But everything that we focus on is the single focus on bigness. And just like you saw this nice spread of effects with Shirley, many things changed with her facial expression, she looked happier, etc. So it goes with LSVT Big. We have found through clinical application and through research is that many other things change when we focus on bigness. We see improvements in posture, in balance, in speed of movement, in flexibility and range of movement, and some of that is reflected in this cute little cartoon sketch here. So go to the next slide. The next key principle is mode. Cynthia talked about the mode of LSVT Loud being very intensive over a 1-month time frame. So the LSVT Big protocol is directly derived from LSVT Loud so that our mode of delivery is the same. The treatment, whether it's physical therapy or occupational therapy, is 4 consecutive days per week for 4 weeks so that there's 16 sessions in 1 month. The sessions are hour-long, and you have daily homework assignments so that you can really get in the habit of practicing these bigger movements and applying it to your daily life every single day of the month so that when you're discharged after 1 month, that carryover really happens nicely. LSVT Big is always delivered in a one-on-one intervention. It's not a group intervention. It's skilled physical or occupational therapy delivered by someone that has been certified in LSVT Big. So they've either attended an in-person or an online 2-day training and certification workshop so that they can deliver this treatment. Next slide. The last of these key principles is calibration. And what we have noticed over the years with people that have Parkinson's disease is that there's a mismatch between how a person perceives their movement or their posture to be and how others perceive it. And interestingly, even in patients that have very early Parkinson's disease, we have had countless times where patients have come in and didn't realize that one of their arms wasn't swinging, didn't realize that their posture was slightly flexed, because these deficits start subtly, they progress slowly over time, and there's a problem with sensory awareness in the body. And so initially when we start training people in LSVT Big, it feels too big to them. It feels kind of awkward. And thus you can see the quote on the bottom of the page where the patient says, "I can't move like this. People will think I'm crazy." And sometimes when we initially show them, maybe through videotaping, what their movement looks like, patients commonly say, "I had no idea how small my world had become." And so our goal for our patients is really to not only get a person moving bigger and more normally, but get them to the point where they can reproduce that more normal movement on their own without the therapist cueing them. Next slide. I want to go over some of our data briefly on LSVT Big. LSVT Big has been around only several years, and our first randomized control trial was published in 2010 in movement disorders. And we call it the Berlin Big study because the study was out of Berlin, Germany area. So in this slide, you see a snapshot of the study. There were 60 patients that were randomized into 3 groups. On the left side, you see that 20 did LSVT Big. In the middle, 20 did a Nordic walking protocol. And on the right side, you see 20 did a home exercise program group that was specific to their Parkinson's symptoms. Now, the groups that received LSVT Big and Nordic walking each had 16 sessions of physical therapy delivered by Olaf Kaufhold, the researching physical therapist in this study. LSVT Big was prescribed and delivered 4 times a week for 4 weeks, and the Nordic walking group was twice a week for 8 weeks in a group intervention, which is typical and traditional in Germany. So you can see that 20 completed the Big group, 19 did the Nordic walking group, and 19 did the home exercise program group. And then they followed them up to 16 weeks, which is the end point of the study. Next slide. So you'll see the primary outcome measure that they looked at in this study was something called the UPDRS motor score. And that is a rating scale that neurologists or movement disorder specialists commonly use to rate symptom severity in people with Parkinson's disease. And they can also monitor changes over time in someone's symptoms and monitor effectiveness of certain drugs that might be prescribed. So in this case, you can see the dashed line on the bottom was the LSVT Big group. On the top, the solid line was the home exercise program group, and the dotted line was the Nordic walking group. You can also see that the only group that changed and a reduction in score is an improvement. And so the only group that changed was the LSVT Big group. And that amount of change and difference between those groups was 5 points on the UPDRS. And that was statistically significant. So that was an exciting first study. One of the other interesting things that you'll see here is that even though the end of the treatment dosage for the LSVT Big group was at 4 weeks, that group actually continued to improve. As you can see, a further slight reduction in their UPDRS motor score. Really exciting. I would assume that it was because of continued daily practice that we know is so important after discharge from physical or occupational therapy. Next slide. So now that we've gone over some of the key principles of LSVT Big and the key randomized control study that was published, I'd like to give you an idea of what the LSVT Big protocol looks like in case you haven't had a chance to receive that treatment yet. This is a snapshot of one of those daily 16 one-on-one therapy sessions that you would have with your physical therapist or occupational therapist. On the left side, you can see that there are 7 daily exercises, and we'll talk more about those in a minute. On the right side, you can see that there are functional component tasks, walking big, and hierarchy tasks. And so all of these activities are really focused on learning how to move bigger so that the movement is more normal, and then applying that bigger movement to functional tasks that are unique to each individual. Next slide. So you'll see the first two exercises are called maximum sustained movements. You may recall Cynthia talking about LSVT Loud doing a sustained ah for as long as they can. In LSVT Big, we do sustained movements of the body. And so you can see the pictures of Jenny here really holding her arms out big, and in the second picture doing a sustained stretch. So she has big posture, a big stretch of her leg, a big arm movement, and this really helps to build the endurance of maintaining posture that's more erect and gives more dynamic stretching. You can imagine if you've got that nice stretch of your leg, how that might improve your ability to take longer steps when you walk. Next slide. The next set of exercises are called multi-directional repetitive movements. These three exercises are stepping in all different planes. So you can see Jenny stepping forward, and then she returns to start position, stepping sideways, and stepping backwards. And these exercises not only train a patient to step with larger amplitude and move their arms with bigger movements, but functionally, we need to move in all directions depending on what we do in everyday life. These also improve balance and coordination and stamina. Next slide. The last two of the exercises are called multi-directional repetitive movements, which are rocking in nature. And so in this one, Jenny doesn't take a step forward and back, but she does a rocking motion forward and backward with big arm swings, and then a twisting motion where she's rocking from side to side. All of these exercises are practiced repetitively, generally 8 to 10 repetitions on each side of the body, and the therapist really uses their skill to help you learn how to do those movements with good quality, with good balance, and with as much bigness as you can while being safe with your movements. Over time, as a person progresses, they add in other challenges such as dual tasking, balance challenges, and so on to improve your mobility, balance, and function. Next slide. So while the exercises are very important and in improving amplitude and balance and all of those other things that I just talked about, they're really not the end-all and be-all. We talk about them being stepping stones for use of good big movements in everyday life. So in other words, your body has to relearn how to generate those bigger, more normal movements so that we can effectively translate them into improved function. Next goal, or next slide. So now you see Jenny in a side-by-side picture doing the forward rocking and reaching exercise, and next to her you see a woman walking her dog, and I think very easily you can notice the similarities in those movements. So again, they're tools to facilitate improved movements, but being an expert at the exercises is not the end goal of therapy. Next slide. So after that, within a session, those generally take anywhere between 50 and 30 minutes of a session to do those 7 exercises. We move right into focusing on big movements with functional tasks. So for every patient, we pick 5 simple movements that are important to the patient. I listed an example of what one patient's 5 tasks were. So they wanted to practice rolling over in bed. That was difficult. Sitting to standing, and you can see the picture of Jenny doing her big sit to stand here. Reaching for things, because this patient often reached for things that were dropped on the floor or reached in the cupboards for things. Stirring, because the patient liked to cook every day, and pulling their pants up. So each of those activities is practiced for 5 repetitions at home and 5 in therapy. That's 10 repetitions of each of those tasks every day for 30 days of the month. That means there's 300 big repetitions of each task in 1 month, not to mention all the big movements that we just went over in those maximal daily exercises. So really, a person within 1 month gets thousands of repetitions of bigger movements that are needed for everyday function. Next slide. The next part of the treatment is not just practicing those simple tasks, but then we really sit down and learn what are some complex tasks that are important to you as a person with Parkinson's disease. And for some people, they have a goal of simply being able to get from the bed to the bathroom at night when their medications are off in a safer and more efficient manner. And for some patients that are very early in their disease, they want to continue to be able to do recreational things that bring them joy, such as playing golf or hiking or gardening. So we really train those activities over 4 months so that the end goal is that you can perform that whole complex task, keeping your movements alive, keeping your movements big the entire time. Next slide. The last thing that we do within every session, and sometimes it's mixed in between tasks or as a separate part of our treatment, is big walking. Now, when we say big walking, it doesn't mean that we're training people with Parkinson's to walk with huge arm swings and huge steps that look abnormal. Our goal really is to normalize amplitude of your step length, your posture, your arm swing, so that your walking appears more normal and actually becomes safer in a variety of settings. So your therapist will work with you one-on-one in a very structured way to gain that skill so that just like Bernie, you can carry that out in everyday life after discharge, even when your therapist isn't there instructing you. Next slide. The last part of every session is the homework. So not only does each person do those exercises and practice those functional things at home, but we also have carryover exercises, which are assignments that your therapist will mandate so that you can gradually learn how to use those bigger movements in real-world situations outside of the treatment room. Our goal is that you really become comfortable with moving bigger in public, especially since at first bigger movements can feel kind of awkward until you become more accustomed to it. But by the end of the 16 weeks, through all of this practice, and both in the treatment room and in the real world, many patients get to the point where they say that they're either used to moving in that bigger and more normal way and that it feels good, or perhaps they don't even really have to think about it anymore. Their bigger movements have become more automatic for them. Next slide. And that is our ultimate treatment goal for all of our patients, that they would use their bigger movements more automatically or at least more habitually in everyday living, and that there will be long-term carryover of that increased amplitude use, so that whatever treatment gains that you work so hard for over that 1 month aren't automatically lost as soon as you stop therapy, but they're maintained over time. Next slide. So our patients really are our living proof. A couple of quotes that we've shared with you here, and we could give many more, are from a patient that went through LSVT Loud and said, "My voice is alive again." And another that went through LSVT Big said that LSVT Big has changed my life. I can free walk, arise from any armless chair, in and out of the car in a flash, and the impact on my life is beyond a miracle. And that's really the hope that we want to give to you if you are a person living with Parkinson's today, is that medications are so important, but if you stop there, you might not get the full benefit of what you could do through intensive and evidence-based treatment like LSVT Big and LSVT Loud. So we really hope that you would consider these treatments for yourself so that you can have improved quality of life as well. We want to go over some resources for you next. I know that we have a mixed audience today. I'm glad that we have some therapy professionals and also some people with Parkinson's that are in our listening audience today. If you're a therapy professional, and you go to the next slide please, here's a basic snapshot of how to get started with LSVT Big and LSVT Loud training. You can go to our website and click on either LSVT Big or LSVT Loud and go to online courses. Our online courses are newer, but they're very, very popular because of the convenience and flexibility and also the learning format that you can go back and review the information as much as you want to. It's the same content, the same certification and CEUs as a live workshop. The more traditional way of learning is to go to an in-person LSVT Big or an in-person LSVT Loud workshop, and we have those all over the world. You can always find our schedule on our website, and at the end of this slide set today, you'll see a listing of all our upcoming live workshops as well. Next slide. If you're a person with Parkinson's disease, you might be wondering how to get started with these treatments, LSVT Big and LSVT Loud. The first thing to do is ask your doctor for a referral to speech therapy for LSVT Loud or physical and occupational therapy for LSVT Big. And at least for the PT and OT prescriptions, those really just need to say evaluation and treatment, and then the therapist can evaluate you and determine if you're a good candidate for that treatment. You can go to our website, lsvtglobal.com, and the first tab is called Find a Clinician. And through that, you can do a geographical search to find a certified clinician in your area. And then lastly, we do have DVDs available to introduce you to those movement exercises that we mentioned today in our webinar. Those can be found through our website, or you can find them through Amazon.com, and the link is shown here. And very soon, those will be available through Vimeo for download or streaming for your convenience. Next slide. So some other resources that we're not going to go into great detail today, but we did include some slides at the end of this webinar, and we'll make sure that everyone has the handout today. Are some other key things. So we've talked about the live workshops, but I also wanted you to know that if you're a person with Parkinson's, at every live workshop on the second day, we have a free 2-hour patient symposium where you can come and listen to a lecture similar to this one, and then have a chance to do some hands-on practice of those exercises with the therapists that are attending these courses. And they're really fun opportunities, both for people with Parkinson's and caregivers, and also the participants in these workshops. We have a number of professional meetings that we'll be attending this year, so if you're a therapist and coming to those meetings, we'd love for you to come to our booth and meet us. If you're a person with Parkinson's, we have a number of Parkinson's events that LSVT Global will be represented at as well at, including the Victory Summits and the Partners in Parkinson's events, in addition to the World Parkinson's Congress. So please be sure to check out those slides, and there might be a Parkinson's event coming to your area that we'd love to have you attend. Lastly, we have some future things that are going to be in development this year. We have an LSVT Loud app for clinicians and patients that will support homework and practice and education. This spring, we're launching LSVT Big for Life and Loud for Life training classes for clinicians who want to lead maintenance groups for patients that have gone through LSVT Big and LSVT Loud. And lastly, there are some additional video resources that are coming your way this year. We have just shot Volume 2 of an LSVT Big Homework Helper DVD, which is going to be seated and supine adaptations for people that have mobility difficulties or more advanced Parkinson's disease. And so that'll be coming out later in the year. Next slide. So we have some time left now at the end. We want you to ask questions, and I think that all of you, or some of you, have already started to ask questions, which is great. If you haven't attended a webinar before, there's a few easy ways that you can ask questions. One is to type in your question in the question box in your control panel. You should see that on the right-hand side. There's a little plus sign beside questions. If you click on the plus, it'll open it up and you can type it in. And when we see your question, we'll read it out loud, and either Cynthia or I can answer that question. The second way is that you can raise your hand. You'll see that there's a hand icon in your control panel. If we see that your hand is raised, we'll call out your name so that you know that you're being called on. We'll unmute your microphone, and after that, you'll be able to ask your question out loud. The third way is simply by emailing us. If you think of questions later after the webinar, you can always email us anytime at info@lsvtglobal.com, and we can connect you with an expert. So with that, I'm going to go to the next slide, turn it back over to Cynthia, and we just thank you for joining us today for this webinar, and we hope that this information was useful to you.
Excellent. Thank you, Laura, so much. So we do have a few questions that have come in, and I believe that both of these, Laura, are going to be directed to you. So I'll start with the first one. And what exercises help with rolling over in bed?
Fabulous question. So that rolling over in bed can be a tricky situation for many people with Parkinson's disease, especially when there's covers on or medications are not working right. And so that is a very common activity that we include within the LSVT Big protocol as a functional task, a functional component task, or a hierarchy task. And what we do in that case is work with the patient one-on-one in making that movement much bigger than you think that it ought to be or that it needs to be. And we practice that very, very repetitively. The therapist stands right beside the patient and gives that patient encouragement and cueing and feedback about the bigness of that movement. As the person progresses and becomes more comfortable and more capable of rolling in a big way on a flat surface with no sheets, then we start adding in complexities like blankets and sheets and time elements and things like that. So if this is a thing that's difficult for you, if you haven't received LSVT Big, I would definitely recommend that you consider that and talk about that specific difficulty with your therapist that you find.
Perfect, thank you. Next question, and I believe since these are from the same individuals, probably related to LSVT Big. Doing these exercises aren't too hard when my meds are good, but how can they help, or how can we help when I'm off?
Another great question, thank you. So you're right, using the medications makes the movement a bit easier, and when medications are worn off, as they sometimes are, movement can be much stiffer, much slower. When I have patients like this, I really try to provide some of my treatment sessions in that medication wearing off time period so that my patients learn how much more effort is needed to move more normally, more bigger in those time periods. So for example, I've had patients in the past that say, you know what, I can do my movements, my exercises, I can walk quite well when my medications are on, and it really only takes me a 4 out of 10 effort to do that. But when my medications are off, it takes me an 8 out of 10 effort level to generate that same bigness of movement. And so it really does take some one-on-one skilled intervention with your therapist, not only during your medication on times, but your off times, so that they can give you feedback of your movement and how big it should be, how much effort you need to feel like you're producing during both times.
Great, thank you. One more question that's a very common one, and I can answer it from speech perspective, and then I'll hand it over to you for PTOT. And so many people say, will anybody pay for this? Is this reimbursable? And the sort of overall answer is absolutely yes. We've had great success with reimbursement across a range of different insurance plans, Medicare reimbursement, and there's always caveats at every level. So the key variables are to know what your plan is and what your plan offers. Talk with your provider, be it speech, physical, or occupational therapist, and work together to be able to provide, your therapist should be able to provide proper documentation related to your medical necessity, your progress through therapy, and your goals. And documentation can be a great success for LSVT protocols. Another question, or two more have come in, so let's get through these two and then we'll be close to wrapping up. So my husband went through LSVT Loud a couple years ago but has not continued the daily exercises. Is it best to do LSVT again or just start the exercises again? This brings up a wonderful point, whether it's LSVT Loud or LSVT Big. It's not uncommon that someone has a great treatment outcome. Perhaps you keep up the exercises for 3 months, 6 months, 3 years, but inevitably there may be a period of time when you fall out of the exercise habit. What we recommend is that you should actually go back to your LSVT Loud therapist. If he, she, or is no longer in your area, look for another one, and this could be true for LSVT Big as well, and have them do a reassessment, because that therapist would know where you were at the end, be able to do some stimulability, and then be able to provide the best recommendations of, you know what, let's come back in, let's do some tune-up sessions. And sometimes that's all you need, not all 16 sessions of LSVT again, but perhaps anywhere from 2 to 6 sessions, get back in the habit, and then go forward and do the continued exercises. If it's been a very long time, if there's been changes in disease severity, perhaps sometimes you may need all 16 sessions again. But your best bet is to go back in and ask for a reassessment, and that's a completely reasonable plan of care to be able to move forward. As Laura mentioned, we're in the process and very close to launching our Loud for Life and Big for Life programs, which will allow people such as your husband at the end of the 16 individual sessions to perhaps have a weekly group exercise class that can sometimes help keep that motivation flowing. One last question for the day. Laura, this one will come back to you. Besides rolling over for exercises, are there other movements that will help? And I'm assuming this goes back to rolling over in bed.
Yes. So I guess what I would say for you is that it really depends on what's important to you and what is difficult for you. When a person comes in for an evaluation for LSVT Big, our goal is to really get to know that person. So we not only assess what is difficult for them, what has changed because of Parkinson's disease, but also what do they want to keep doing, despite the fact that Parkinson's might progress slowly over time. And so the exercises that you saw, those 7 maximal daily exercises, are important, but what's even more important is customizing that functional application to you. So it might be practice of bed mobility, including rolling. It might be more complex than that. It might be the ability also to get your legs in and out of bed, to throw the covers on and off, etc. And so I'm not sure if I'm clearly answering your question, but I guess the bottom line is it needs to be custom tailored to you and to what your functional goals are. And then we train amplitude to be able to overcome that slowness of movement and small movement typical of Parkinson's disease, so that you can perform those functional tasks more normally again.
Excellent. Well, with that, we will close the webinar. We'd like to thank you all again for attending. We hope this was helpful. This webinar will be available for on-demand viewing, accessible through our website. So if you have friends or colleagues that you think might find this information useful, please feel free to share that with them. One last reminder, when you close out of the webinar, there's a short survey that will launch. If you can take just a few more moments, complete that. It's very valuable to us. So with that, we'll say farewell and thank you very much.